Hello, I'm Daisy Perez. I'm a public health undergraduate student of San Jose State University. I will be discussing the racial and ethnic differences in the willingness to receive the COVID-19 vaccinations among the social networks of diverse public health students. My research question is, what are the differences in willingness to receive the COVID-19 vaccination among different racial and ethnic groups? Are racial minorities more hesitant to receiving the COVID-19 vaccination? What percentage of respondents from the public health students' social circle are not willing to get the COVID-19 vaccination? So for some background, data on the United States population suggests that racial minorities such as the Black and Latinx communities are least likely to receive the COVID-19 vaccine. Historical and current systemic racism contributes to vaccination hesitancy and high levels of skepticism in racial minority groups. Misinformation from popular sources has also influenced the trust of public health students and their social circles. So for methods, undergraduate epidemiology students of San Jose State University conducted a cross-sectional study in October of 2020 with 391 respondents who participated. Students surveyed their social networks about their demographics, vaccine willingness, and sources of trustworthy vaccine information. As you can see here, the public health students' social circles is very diverse, as we had a number of different race and ethnicities who participated in our survey. So for the results, overall, about 45% of all respondents said that they probably not or definitely would not be willing to receive the COVID-19 vaccine. If you look closely, you will see that the Black, multiracial and other, and Latinx participants were less willing to receive the vaccine amongst all of the other racial and ethnic groups. With 92% of the Black participants who answered probably not or definitely not willing to receive the vaccine, 63% of multiracial and other, and the Latinx participants at 44%. Although it is not included on this slide, it is important to mention that the level of trust in family and friends to provide accurate vaccine information was lowest amongst the Black and Latinx participants when compared to all other groups. In conclusion, racial minorities were least likely to receive the COVID-19 vaccine. It is important to address these disparities to help engage more people in utilizing preventative health care. Given that racial minorities are often met with other obstacles, such as less access to health care and are generally a more at-risk population, utilizing preventative health care would be essential to them. It is also important to mention that disparities in vaccine willingness have actually diminished since October of 2020 and have increased over the last several months. These disparities also influence the sources of vaccine information that persist among public health students' social network. Due to systemic racism, racial minorities are less likely to trust sources for vaccine information and will be less willing to receive the vaccine. In October of 2020, public health students might have been more primed to be suspicious of the vaccine development process than the general public after the CDC released inaccurate information regarding the magnitude of COVID-19 rates at the time. It is important to mention that diverse public health students may be an important source of information for their communities, as this is their topic of interest. Thank you so much for listening to my presentation. My contact email is at the very top. These are fellow authors that worked with me on this study, and I would like to acknowledge the Fall 2020 Epidemiology course for the survey and the Thoracic Foundation for the funding. Thank you so much.